So at the end of the last video, I mentioned FAST, the FAST mnemonic, but I recognize that I didn't really explain that very well. So I wanted to have a video just explaining this mnemonic. So we used to use the FAST mnemonic to memorize the symptoms for strokes, but they've actually updated it to be FAST to add a couple more symptoms that you might commonly see for strokes. So there's nothing new here. We talked about all these symptoms in the last video, but just kind of as a way to remember what all the symptoms are of a stroke. Remember, if you see any of these symptoms, you should be concerned that the person might be having a stroke. So B stands for balance, if they have any sort of loss of balance. E stands for eyes, anything that comes on suddenly with their eyes, whether that be blurry vision, double vision, maybe loss of vision in one eye, anything like that could be a sign of a stroke. As well as facial droop, as we said, you can ask them to smile or show their teeth or stick their tongue out, and you may see one side droop down or their tongue go to one side or the other. A stands for arms. The best way to check this one is ask them to close their eyes, raise their arms up in front of them with their palms up. And if one arm drifts back down or doesn't raise as high as the other arm, that would be another symptom of a stroke. And S stands for speech. Again, that could be anything from dysarthria, where they have slurred speech, to aphasia, where they're just unable to communicate or even understand what's going on. And then T stands for time. As always, we want to quickly get them to the hospital, and I think we covered that pretty well. So make sure they get to the hospital quickly. But if this sounds kind of like the Cincinnati stroke scale that you may have learned long ago, it is basically the same thing. It's just a lot easier to remember be fast or fast rather than the Cincinnati stroke scale. You have to kind of separately remember those steps. So these are the things you should check for if you think somebody's having a stroke.